Hey everyone, and welcome to our channel. Today we're diving into a topic that affects many, yet few understand: tumors. Did you know 1 in 3 people will develop a tumor in their lifetime? But here's what your doctor might not have time to explain. In the next 2 minutes, I'm going to break down everything you need to know about tumors, from the scary truth to the hopeful breakthroughs that could save your life. Let's start with the basics. A tumor is basically your cells having a party they weren't invited to. Instead of growing, aging, and dying like they're supposed to, these rebel cells keep multiplying and forming masses. Think of it like a city where the construction crews never stop building. Eventually, you get overcrowding. Now here's where it gets interesting. Not all tumors are created equal. Benign tumors are like that quiet neighbor who keeps to themselves. They grow slowly, stay in their lane, and rarely cause trouble. Examples include lipomas, those fatty lumps under your skin, or uterine fibroids. Malignant tumors? They're the complete opposite. These are the home invaders of the medical world. They grow aggressively, break into neighboring tissues, and can travel through your bloodstream to set up shop in other organs. That's called metastasis, and it's what makes cancer so dangerous. There are 4 main types of malignant tumors you should know about. Carcinomas attack your skin and organs. Think lung, breast, or colon cancer. Sarcomas target your bones and muscles. These are the rare but aggressive ones. Leukemias hijack your blood and bone marrow, and lymphomas mess with your immune system. Each type has its own personality and treatment approach. Here are the red flags that should send you straight to your doctor. Unexplained lumps anywhere on your body, and I mean anywhere. Sudden weight loss without trying. We're talking 10 pounds or more in a month. Extreme fatigue that doesn't improve with rest. Persistent pain that doesn't have an obvious cause. Changes in your skin, new moles, yellowing, or sores that won't heal. Changes in bathroom habits. Blood in your stool or urine is never normal. Neurological symptoms like seizures, vision problems, or severe headaches. Difficulty swallowing or persistent hoarseness. Night sweats that soak your sheets, and swollen lymph nodes that feel like marbles under your skin. So what causes these cellular rebellions? Sometimes it's genetics. You can inherit faulty genes like BRCA1 that increase your risk. But most of the time it's environmental. We're talking about carcinogens, tobacco, asbestos, UV radiation from the sun. Certain infections like HPV and hepatitis can also trigger tumor formation. And let's be honest about lifestyle factors. Poor diet, excessive alcohol, and being sedentary all contribute. Age is also a factor. 60% of tumors occur in people over 65. Diagnosing tumors has come a long way. We have MRI and CT scans that create detailed 3D images of your soft tissues. PET scans can actually detect metabolic activity. Cancer cells are hungry little things and light up on these scans. But the gold standard is still a biopsy, taking a sample of tissue for lab analysis. Here's something cool. Liquid biopsies are the new game changer. It's just a blood test that can detect tumor DNA floating around in your bloodstream. No needles, no surgery. But here's where it gets really exciting. Treatment options have exploded in the past decade. Surgery is still the go-to for removing tumors. But now we have precision radiation therapy that can target tumors with millimeter accuracy. Chemotherapy has evolved too. Instead of carpet bombing your whole body, we have targeted therapies that attack specific mutations. But here's where it gets really exciting: immunotherapy. We're literally training your immune system to recognize and destroy cancer cells. And CAR T-cell therapy? We take your immune cells out, reprogram them with software, and put them back in as tumor hunting missiles. It's like giving your body superpowers. The best part: prevention. Avoid carcinogens, quit smoking, limit alcohol, or sunscreen. Get vaccinated. HPV vaccine prevents cervical cancer. Hepatitis B vaccine protects your liver. Regular screenings are crucial. Mammograms after 40, colonoscopies after 45, annual skin checks. Diet matters too. Load up on cruciferous vegetables like broccoli, berries, and turmeric. Exercise for at least 150 minutes per week. This alone reduces tumor risk by 20% and manage your stress. Chronic stress weakens your immune system. 5-year survival rates for many cancers are now over 90% when caught early. Breast cancer, prostate cancer, thyroid cancer. These used to be death sentences. Now they're manageable conditions. Even pancreatic cancer, one of the most aggressive, has new treatment options. The key word here is early. That's why knowing your body and getting regular checkups isn't just important. It's literally life-saving. Knowledge is power, and your share could be the reason someone gets checked early. What questions do you have about tumors? Drop them in the comments below, and let's talk.